My name is Kikelomo Odiebo. I'm a Lagos-based journalist and also the Vice Chairman of KMC LASAM. Now I'll be sharing our journey so far using the Advocacy toolkit in Lagos State. Evidence for Action MamaYe builds capacities of state-led accountability mechanism in using evidence to power targeted advocacy. A toolkit was developed to guide coalitions in using the 6 steps for advocacy to achieve the desired results. LASAM applied the advocacy toolkit to promote increase in health allocation to 15% of the Abuja 2005 Declaration of African Heads of States in Lagos States. Now step 1, which is defining the problem. What did LASAM do? LASAM used the political economy analysis to define and understand the health budget and reproductive, maternal, newborn, child and adolescent health RMNCAH plans and budgetary allocations processes in Lagos State. The problem 3 was used to identify and prioritize the problem, which is inadequate health financing. For step 2, which is thinking and working politically. In an attempt for LASAM to think and work politically, LASAM used political economy analysis tools to map the budget cycle and also understand the different actors or stakeholders in each of the stages of the budget cycle and what level of interest or influence or even power they have to effect a desired change in each of the stages. So what did LASAM do? The stakeholder mapping done identified the following people and they were targeted with different advocacy acts for them to use their influence or power to effect the desired change in the health budget allocation in Lagos State. Some of the people that were identified include the Executive Governor of Lagos State, the First Lady of Lagos State, the Commissioner and Director of Budgets, Ministry of Economic Planning and Budgets were identified so that it can lead to increase in total health budget share to 15% and also approve RMNCAH budget allocation for disbursement timely in line with budget plans. Okay, for step 3, which is finding the information needed. LASAM conducts health budget performance reviews and analysis quarterly to know, determine the fund allocation and also release to health and RMNCAH using the state budget data. It is imperative to state that LASAM uses the health budget performance review data to develop annual health budget scorecards yearly, and this is disseminated to relevant stakeholders. LASAM also conducts health budget media roundtables to interpret health budget scorecard data for them to use the evidence to write objective stories that will spur the policy stakeholders to take action that would increase health budget allocations and timely release of approved funds in Lagos State. Step 4, which is coming up with solutions. It is worthy to note that the findings from the health budget scorecards are used to develop solutions in form of acts targeting the identified stakeholders to take required actions to increase the health budget share to 15%. Now, to this end, some acts are put forward to relevant stakeholders in Lagos State, which were the state government should increase the health allocation to 15% in line with the Abuja 2005 Declaration, and that the Ministry of Health should increase the budget allocation to RMNCH. On 5, which is taking action. One key component of our advocacy drive is the use of evidence to engage policy stakeholders. To ensure this, the Health Budget Scorecard is produced annually and it is disseminated to stakeholders. Now, LASAM uses the budget health evidence to engage policy stakeholders via the following activities. Number 1, Health Budget Scorecard dissemination meetings, participation in state budget preparatory processes, also Lagos Health Financing Dialogue, and the last but not the least is a social, online and traditional media campaigns. Other stakeholders who participated in one-on-one advocacy programs and amplified voices in the online advocacy campaigns include, but not limited to, NORI 2, Save the Children, and of course, DEFCON's network. Now the final step, which is step 6, tracking results. At LASAM, we understand that tracking of results is key to us in measuring our contributions to improved health outcomes for mothers, babies, and adolescents in Lagos State. Some key results that LASAM has seen from sustained advocacy for improved budget allocation to health and RMNCH since 2016 are as follows. 1. Progressive increase in health budget share. Health sector budget allocation increased from 6.33% in 2017 to 8.84% in 2018 to 9.87% in 2019 to 12.32% in 2020, that's post-COVID emergence, and of course now to 9.08% in 2021. 2. MNCH budget increased from 86.74 million in 2017 to 186 million in 2018 to 239.76 million in 2019, and of course to 362.64 million in 2020, and presently it was put at 304.93 million in 2021. A separate budget item was allocated to family planning in the Ministry of Health budget in 2018. It was initially subsumed under reproductive health budget item. The family planning of the Ministry of Health budget increased from 4 million in 2017 to 61 million in 2018. We had 40.5 million in 2019, and it increased to 125.80 million in 2020, and presently in 2021 it is 82.575 million. Number 4, we see increase in reproductive health commodities allocation from 50 to 100 million in 2019 and to 227 in 2020. Number 5, for the first time in 2017, the Lagos State Primary Healthcare Board had a dedicated family planning budget item in its annual budget with an allocation of 50 million for FP consumables. And this budget item has been maintained in the PHCB annual budget since then to this present time, year 2021. We are the Lagos State Accountability Mechanism for Maternal, Newborn, Child and Adolescent Health, LASAM for MNCH. The goal is to ensure that we continue to use advocacy toolkit to advocate for increased health budget allocation to 15%. And until this is done, it is a matter of no retreat, no surrender. And when this is actually achieved, we will continue to advocate to sustain the gains for improved health outcomes for mothers, babies, and adolescents in Lagos State.